Alzheimer's affects millions of Americans, but the true effect falls on the loved ones, the ones that watch a person disintegrate, because a person that can't remember that he can't remember. Today we're going to just look at a new discovery, a discovery that can help millions of Americans. We will sit down, we will talk with doctors, but before we do, I wanted to sit down with the loved one who has been affected by her husband losing his memory. I have with us today Mrs. Pat Blackshear. She is the wife of Joe Blackshear. Now you're going to meet Joe in a few minutes, but I wanted you to meet Pat first because Pat is the one that is mostly affected. Welcome to the Eye of the Tiger, Pat.
Thank you.
Thanks so much for your courage to sit down with us today, because I can imagine that living with Joe and the Alzheimer's is quite a chore, and it probably has been. Can you talk to us a little bit about how he was before he started with this new medication, and then the changes that he's moved into now?
Okay, at first that he couldn't remember. He was real confused. He couldn't do activities, cook, nothing. Now he can.
So his motor skills in terms of activities, could he remember in a conversation? Would he repeat himself in conversation?
Constantly, over and over, the same thing, over and over and again.
Right. So what you would say, you've already told me that, Joe.
Yes.
Yes.
Mm-hmm.
And then would he say, did I?
No, he would, a few minutes he'll go back and say the same thing over and over again.
Really?
Mm-hmm.
Wow.
Mm-hmm.
Yeah. I know some people like that repeat themselves like that. So it progressed to the point where he couldn't remember how to do certain functions?
He couldn't cook. I had to dress him. He used to mow the yard, drive. He couldn't do none of it.
None of it.
Mm-mm.
That must have been very sad for you.
Yes.
Yes, absolutely. So then he went to see Dr. Wagner,
Mm-hmm.
and Dr. Wagner was able to help him with this new medication.
Mm-hmm.
So tell us about that and how he changed.
Okay. When I took him to the hospital, Joe didn't even know what hospital he was at.
Mm.
He didn't know what floor he was on. Just different things. It was really kind of getting a little aggravating.
Mm.
But now on this new medication, I don't really trust him cooking, but I like to be there when he cooks.
Right.
He can cook, but I like to be there. But I don't let him drive. He can dress himself now too.
That's great. How long has he been on this medication?
I said 2 months.
2 months.
Mm-hmm.
And in 2 months, you've
Mm-hmm.
seen a big difference in
Mm-hmm.
him? Wow.
Mm-hmm.
That is awesome. What a blessing that is.
Yes, it has been a
Yes,
blessing.
what a blessing. Absolutely. Wow. You know, I can't say how happy I am for you that you have taken him to Dr. Wagner, and with Dr. Brinkley's help, that he has come back to himself.
Mm-hmm.
Wow. You know, thank you so much for sitting and talking with us.
And thank Dr. Wagner and Dr.
Yes, yes, 'cause, yeah, absolutely. So in a minute, you're going to get a chance to meet Joe and Dr. Wagner and Dr. Brinkley. You stay tuned.
I want to transform the nation. I want to impact the world, but I don't know how. I'll start here. Yeah, here.
Tennessee State University, transforming the nation, impacting the world, one student at a time.
I feel my job is extremely important in knowing that you've helped people out on the ground, the firefighters in particular. Just the fact that they see us up there making an effort gives them a lot of comfort. In my civilian job, I fly people from point A to point B, but in the Air Force Reserve, I get to save lives. I'm Major Mark Stewart, and very proud to be a member of the Air Force Reserve.
So, are you going out tonight?
I can't. My parents say I have to be home right after work.
That's so gay.
Totally gay.
Ugh, that is so Emma and Julia.
Why are you saying that's so Emma and Julia?
Well, you know, when something is dumb or stupid, you say that's so Emma and Julia.
Who says that?
Everyone.
Imagine if who you are were used as an insult. When you say that's so gay, do you realize what you say? Knock it off.
In January of this year, a pilot study was published in the Archives of Neurology, indicating that patients suffering from Alzheimer's disease and early dementia might be able to slow or possibly even reverse symptoms of memory loss. The new treatment is not a pill comprised of highly complex compounds of chemicals, nor is it an invasive procedure. It does not present the patient with significant risks, nor does it have side effects more serious than the occasionally runny nose. So what is it? It's insulin. Inhalation of insulin is improving memory. This groundbreaking insulin therapy has found its way to Nashville. And here to discuss this scientific wonder with us today is Dr. Mark Brinkley, compounding pharmacist and chemist of 36 years at the Health and Wellness Compounding Pharmacy here in Nashville. Dr. Martin Wagner, practicing neurologist in Hendersonville for over 25 years and clinical professor at Vanderbilt University. Also with us is Mr. Joe Blackshear, a patient currently receiving this new and promising treatment. Welcome. Welcome, Dr. Wagner.
Thank you.
All of you. This is awesome. It is cutting edge. 5.4 million people in America have Alzheimer's. I mean, just to engage in this research and the practical aspect of it is phenomenal. So we got to start at the beginning, though. Okay, so tell us, how does Alzheimer's begin, Dr. Wagner?
Well, Alzheimer's disease, as you say, there are 5.4 million Americans with Alzheimer's, and the numbers are increasing dramatically. Over the next 15 years, 20 years, we're going to see a tripling of the number of Alzheimer's patients in America.
Wow.
And Alzheimer's is a major economic effect on the country because of caregiver burden, the cost of caring for these individuals with Alzheimer's, the cost of treatment for patients with Alzheimer's. The treatment that we've had up to date for Alzheimer's has been more symptomatic, has helped only slightly. And patients begin with a bit of confusion, some memory difficulties, inability to recall things that they knew before, or inability to learn new information. And in addition to that, by itself, memory by itself, is not sufficient to make the diagnosis of Alzheimer's. The patient has to have at least one of another series of problems. It could be aphasia, where they have difficulty with language, communication by language, or they would have difficulty with agnosia, where they can't recognize things by their vision or by hearing or by feeling, things that they could recognize before. Or apraxia, where they cannot conduct things, they can't carry out a motor task, brushing their teeth, combing their hair, maybe dressing themselves, if they get their sleeve turned wrong side out, or higher executive functioning. And the higher executive functioning are things such as planning, organizing, sequencing, and abstraction. So that's how clinically Alzheimer's presents
comes into play,
yes.
Right.
And it's a progressive condition. It's a gradually progressive disorder.
What's the difference between Alzheimer's and dementia?
Well, dementia is it's like saying, what's the difference between furniture and a chair? Chair is one type of furniture. Alzheimer's is one type of dementia. 55% of all dementia in the United States is a result of Alzheimer's disease. The other 45% is a mixture. The second most common type is is what's called Lewy body dementia or dementia with Parkinson's disease. Half of all patients with Parkinson's disease eventually develop dementia. And then the third most common is vascular dementia due to multiple strokes. Now, in Alzheimer's, I have some cards here.
Yes.
Would you like to see this?
Yes, we would love to see those.
These represent the, this is the amyloid, beta amyloid, which is found deposited in the brains of patients with Alzheimer's disease. And this is magnified many times. It's magnified about 1,000 times. But this is an insoluble substance deposited in the brain, starts in a certain area of the brain called the hippocampus, which is unfortunately the area of memory formation and storage.
Right.
And accompanying that, those are also what's called neurofibrillary tangles. And these are actually within the neuron itself, within the nerve cell. The plaques were outside the neurons. These tangles are inside. And I have also this card showing the area. This is an area of the hippocampus, and it's called the hippocampus. It's in the middle portion of the temporal lobe, and it's called hippocampus because it looks like a seahorse. And you can see it in a healthy person here, and then you can see it as there's atrophy that occurs, degeneration that occurs, there's shrinkage of those seahorses.
Right.
So that's what we see in Alzheimer's. And finally, I have this other card here showing, this one demonstrates the decrease in metabolic activity of the patients with Alzheimer's disease. You can see where a normal brain, the bright red is normal activity, and then as it progresses, it becomes shown less and less activity. So those are the areas where there is decreased glucose utilization, and that's how they made these scans, by radioactive tagging of glucose molecules. So you can see the progression.
Yes, you can. You can. You said that Alzheimer's is going to multiply 3 times, if 5.4. Why is that? Do you have any idea? Why?
Well, I think there are different reasons. I'm sure Dr. Wagner could tell us better, but we discussed yesterday the growing incidence of diabetes in this country and the large number of patients who develop insulin resistance and pre-diabetic and full-blown adult onset diabetes, where they were much higher risk of Alzheimer's and dementia than a patient who's not.
So diabetes and Alzheimer's or dementia are connected?
They have common relationships, yes, and that's still part of the research. Why is it working that way?
Right. Well, let's talk about the research. Tell us about the study and how you came upon it, and tell us.
The study was in Puget Sound, Washington State, the VA study. There were 104 patients that were studied, and they were divided into either one group which received placebo, which was the salt water.
Right.
Another third of the patients received 10 units twice a day of insulin nasal spray, and then the third group received 20 units twice a day. And they carried out both cognitive testing, so for memory and other things. They did cognitive testing and functional testing to activities of daily living.
Right.
You know, what are you able to do now that you're on this medication?
Right, exactly.
And what they found is that over the 4-month study, they examined these patients first at baseline, after 2 months, and at 4 months during the insulin treatment. And they found that those that were on the 10 units twice a day had stabilized or improved overall in function.
Wow.
Those that were on placebo, the salt water, as you would expect, continued to decline, and you would expect that a higher dose would result in more effective treatment, but that wasn't so. They found the 20 units twice a day just was in between.
Really? So you have to hit it just right, 10 units twice a day.
Exactly.
Wow. So when did you start utilizing it?
Well, we've been, Dr. Binkley and I got in touch with each other, and about 2 to 3 months ago we began to use it, and started on a few patients, and so at this point we have about 15 patients that we have treated with it.
Great. And we have one of those patients here with us.
We have treated with it.
Great. And we have one of those patients here with us. So tell us, how has it increased the quality of life for you?
Okay. It has made things pretty difficult because I have a memory problem, and I don't seem to be able to remember like I should, like I want to.
Right.
And some days worse than others. And some of the things are very simple things. You might ask me something simple that I can't answer, and that's the memory part of it. And I'm hoping, you know, medication whatever will make things better for me.
Right. Now, has it gotten better since you've started on the insulin, inhaling the insulin? Has it improved your memory some?
Well, I hadn't been full time involved with it since I was issued the medicine, because the way they had it set up for me to use, I didn't, and that way was a little spray gun. You had to spray it in your nostrils, and it just wasn't, I felt, doing like it should, because so now they're supposed to have a better way of for me to use it. I hadn't got that yet, but I will be able to tell you more about it once I get that and start using it.
Right. So, Dr. Brinkley, this is the original way. Can you tell us a little bit about how people are able to inhale it and how the mechanics have advanced?
Well, we can. This is just a very simple nasal spray container that you would grab and press, and it requires a little bit of dexterity and timing, and it's a little more difficulty if the patient is not really on top of their game as they use that spray. So they would need some help in some cases, and others maybe not.
Right.
So it's very simple, but with a device like this, you have really a limited amount of the sinus cavities that you can get this this medication into.
Right.
And so now we were starting to look at a nebulization system, which is the other device here on the table, and consists of a small compressor, much like a respiratory type nebulizer, but this one is specifically for the nose, and with the tubing it uses this small cup, and the patient simply leans over, turns the machine on, and it nebulizes this up into the higher levels of the sinus cavities. So we know we get higher penetration with this type of device. Again, we're starting to experiment to see if that's also going to be true with the insulin as well.
Right, absolutely. Because for sure, if you just take a nasal spray, then you have to and sniff it up in there, try to really get it up into that cavity. Yes.
I also found myself when I was using that device losing so much of it. I never could get the full amount.
Right. So
I spray it and it never did work right, bottom line, and I found myself just losing
the
more
product,
than was
the
going
insulin.
in.
Right.
More,
exactly.
So,
yeah.
I feel like once I get something I can spray and everything goes in and stay in, whatever, it will be much more beneficial.
Right. But like you say, you know, you have to be able to have the dexterity to actually use it properly if you're going to use the handheld versus the power where it's powered up into your nasal cavities. Yeah. So how much of it has to actually get up into the brain, or has there been any study about that part, or how does that go?
There has not been a study showing what % of it actually makes its way to the brain, but we do know that it makes its way to the brain by way of the nerves, through the trigeminal nerves, which supply sensation to the inner portion of the nose and to the sinuses, and by way of the olfactory nerves, which provide the sense of smell, and that goes directly to the brain. Now, in this study in Washington, none of the patients dropped out due to hypoglycemia. There were no drops in blood glucose level of any significance, so no one dropped out due to that. Most of it is finding its way to the brain.
To the brain.
And that's important because we found that patients who have Alzheimer's disease are deficient in insulin in the brain. And insulin, why is insulin so important? Well, insulin is the hormone that is responsible for driving glucose into the cells.
Right.
And why is that important? And it's important because glucose is the primary source of energy for the brain.
Now, how is the medical field in terms of how is this being received? Are people embracing it, you know, on a professional level? Are they saying, well, this doesn't really work, or, you know, how is it being received?
Well, I think the medical community as a whole tends to be very conservative.
Yes, they are. Without a doubt, without a doubt.
So they tread cautiously and they wait for FDA approval, and it may be years from now before that occurs, before we have the results of a much larger study. But here's a medication that's widely available. It's inexpensive, and is fairly easy to administer. And I think if we have a drug that will actually halt the progression or slow the progression, then why not use it? You know,
Absolutely.
We don't have anything.
Absolutely.
There is no disease-modifying therapy available to date until perhaps this insulin nasal spray will be the answer.
Yeah. Well, if you know someone that has Alzheimer's or just can't quite remember, they're repeating on the phone, talk to Dr. Wagner. Talk to Dr. Brinkley, because insulin is on the rise, and there are other vitamins that Dr. Brinkley has that can really help memory. We are happy to share that information here through Tennessee State University, because Tennessee State University has so many wonderful things going on that never see the light of day. And today we have a new segment on the show called TSU Corner that will shed light on those hidden jewels in the tiger. We'll be right back. And don't you go anywhere.